The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Good morning, everyone. It is Tuesday morning, and I am Tony Urbanic, and we are here gathered for the next episode of TMD Demystified. As you know, I try to do these every Tuesday and try to do them in the morning for my scheduling benefit, although you may be watching this at any time of the day or night, and I encourage you to do so. Today, we are going to continue the thought process and the topic of how come no one ever told me about this, part 6. Part 6 is going to cover the responsibility of other dentists and other physicians regarding how come the patients don't know about the problem. I'm going to try to break it down into both of those categories. I'm also going to try to make this presentation a little more concise than the last presentation, part 5, because I went over a little longer than I had thought. Actually, it turned out to be a 39-minute episode. So I'll try to make it up for you on this episode and try to make it brief and understand. But getting back to the topic, and in my mind, it is a very critical and very important topic into solving the problem of TMD. If we're going to solve this problem, and we in our practice and my team members and the other doctors in our network of doctors who use the Urbanic device and protocol have solved the problem for thousands of patients so far. That is a fact. But if we're going to solve it to a much wider, broader group of patients using this device and protocol, I mean, this is the solution. It's not just a piece of resin or plastic. It has a protocol that goes with it, and then you have to understand the protocol. And the people who have to understand the protocol are both the people who provide the service, and the people who receive the service. That's the best way to do it. But the patients consistently come in to see us with a long history of headache, earache, jaw pain, neck pain, ringing, fullness, dizziness, upper back and shoulder pain, arm, hand, finger tingling, and numbness, and various kinds of locking. And along the line, at one point or another, they say, once they begin experiencing significant relief of those symptoms, they will say, how come nobody ever told me about this? And today we're going to talk about part 6 and those that are involved with actually being responsible for not telling the patients about it. Again, it may sound to you as the person watching this episode that I might be trying to point fingers or be critical. No, I'm trying to educate and be honest and straightforward, but actually paint an actual picture of like what's going on here and how come patients can have 10, 20, 30, 40 years of these symptoms and not get relief from something that is so simple, straightforward, and effective. So part 6 is going to talk about the responsibility of the dentist and dental profession and physicians and physician areas. And I'll break it down first by dentist. So, and when I say dentist, what I really mean is general dentist, because patients who are thought to have TMD, either referred in from elsewhere, maybe a PCP, maybe a walk-in clinic, maybe the emergency department, that thinks that their symptoms are TMD, TMJ, will refer them to, usually they'll say their dentist, go to see your dentist. Well, the average your dentist doesn't want anything to do with TMD, or if they do, they make a night guard, give it to the patient, and hope the patient doesn't come back. And that is the standard of care in the dental industry as we speak on this date, which is 11/14/23. That's the standard of care in the dental industry. Now, why? The question, the discussion really needs to be, yes, the dentists don't want anything to do with it. So, and they are partially responsible. They're not totally responsible. I'm not trying to point the fingers at this. What I'm about ready to say is totally describes why. It is not totally encompassing. But you need to ask, why don't dentists have more interest or knowledge or understanding about TMD where they can either treat it correctly or refer it to be treated correctly? Well, the answer is multiple. And again, with my experience in 46 years of communicating on an almost daily basis with my dental colleagues as an oral and maxillofacial surgeon, and having an active practice in oral and maxillofacial surgery in Nashville, Tennessee for that long, I'm very familiar with their thought processes, what they tell me, what they experience. Basically, it boils down to understanding. The general dentist does not understand the problem of TMD. They may have no knowledge. They may actually have no understanding to the point where it's absolutely blank. And that is possible because the dentists put their attention on what they know and what they do on a routine basis. Rightfully so. But if they're confronted by or asked to see a patient with potential TMD, or they have one of their own patients that say, "Oh my God, I think you have jaw joint problems." What are they going to do about it? Well, if they don't understand the problem, they will have no knowledge of what to do about it. They'll have no knowledge of how or who or when to refer it. And that is really the battle. But who is responsible? It is the doctor. The doctor is responsible. And whether they like it or not, TMD has been put into the lap of dentistry. And the majority of dentistry is general dentist. I don't know exact number, but what can we say? Probably 80%, somewhere between 80 and 90% of dentistry is provided by general dentists, not by specialists. Probably closer to 80%, maybe 20% are specialists. I guess that sounds pretty good to me from what I've read or known in the past. So, but the majority of dentistry is done by general dentists. Therefore, doctors, whether you like it or not, you've been given this responsibility. It's part of the practice, whether you do it or not, but it is part of the area that you're expected to operate in. And the majority, like the vast majority of that 80% of general dentists, almost none of them fully understand TMD. And what they do have been told or taught about TMD or how to treat it certainly has not been effective. I think that's an honest, I don't think anyone would disagree. That's why dentists don't want anything to do with it, because they know nothing works. I'm painting an honest picture here, but yet that does not relieve the dental community of the responsibility. So when the patient asks, how come no one ever told me about this? Responsible parties include dentists, and especially general dentists, because they are the majority of the profession. So they don't understand. Well, why don't they understand? Well, number one, busy. They're busy with what they do. They're busy with their crowns and dentures and fillings and periodontal treatment and overseeing their hygienists, and that's what they do. And they gravitate toward what they do well, and they don't want to fool with it. Why? Because they don't understand. They think it's difficult. No, when you understand it, it's actually very simple. And that picture has been painted and explained in other episodes multiple ways, multiple times, how simple it is once you actually take the time, a little time, to understand it. You do not have to be a specialist. By the way, there is now a new specialty in dentistry called orofacial pain, I believe, OFP, orofacial pain. I will allow myself to be criticized to the nth degree, but what I've observed about the oral facial pain doctors is they desire to make this as complicated as possible. I stand by that. I will discuss it with anyone who wants to civilly discuss it with me, because I can debate this topic extremely well. And once you understand the physiology of the temporomandibular joint and inflammation within the temporomandibular joint and how it creates all the symptoms, which is in the science. I didn't make up any of this science. It is in good scientific literature, peer-reviewed scientific literature, explaining exactly how inflammation within this joint creates headaches, creates upper back and shoulder pain, creates ringing, fullness, dizziness. And when the doctor understands that little bit of physiology, cell biology that explains scientifically in the literature, peer-reviewed, how that happens, it's not my literature, it's the general literature, then they're not afraid and they understand. And they can put aside all of the nonsense, the smoke and mirrors that has been used for 60 years or more in trying to treat patients with TMD symptoms. I had a doctor recently. Not only was he didn't understand the problem, but his major concern is if he took on a patient with TMD, he didn't want to be married to the patient because they keep coming back. Well, why do they keep coming back? Because they continue to have symptoms. What you've done or what you're doing for them, doctor, isn't working. So they're going to be back in your office saying, I have more symptoms. Stands to reason. So the dentists are responsible to answer this question to the patient. How come nobody ever told me about it? I have not to this date been so bold or hopefully not insulting the patient by saying, well, go back to your dentist, who either did nothing or gave you a night guard and told you it was TMD treatment, and ask him, how come nobody ever told me anything about this? I have not done that. I'm more civilized than that. I don't like to upset people, although I will confront people on the direct science involved with things, and I can debate the topic extremely well. But yes, doctors, you are responsible to answer to your patients, how come nobody ever told me about this? On the other hand, here in Middle Tennessee, we are fortunate because of our consistent and aggressive educational process throughout the dental and medical community to educate the doctors not only on the problem itself, exactly what is going on, how inflammation creates all the symptoms, but how to properly diagnose it and differentiate it from other kinds of pain, which is extremely easy. Again, it's all easy when you understand the problem and you understand the simplicity of treating it. Unloading a joint like a set of crutches would unload a bad knee, an inflamed knee, and you unload this joint like a set of crutches unloads a knee. You're unloading the joint, allowing the inflammation to go down. How simple can it be? Of course, you need to know a few nuances about vertical dimension, about other things, centric occlusion, centric relation, but topics that were well covered in, or should have been well covered in dental school. Maybe not your dental school. And then, of course, a comment that I've made so many times, all the young doctors being trained in dental schools from the time that before I was trained in dental school, we're told that the temporomandibular joint is a very complicated joint. That is not a fact. That is not true. That is bogus. Temporomandibular joint operates like any other joint in the body. It's just in a different location. It has a little different structure to it. It is somewhat unique, but it's not different. It is not complicated. It's unique, granted, but it's not complicated. If you know how the knee works, then you'll know how the TMJ works. The physiology is the same. The cell biology is the same. The histology is the same. The pathology is the same. How the pathology drives the symptoms is the same. And that same material is all in the literature, peer-reviewed. The other category of physicians. Now, physicians are a little different category. They operate differently. They're trained differently. Physicians are trained from the get-go. From the time you enter medical school till you do your internship, till you do your residency, you're trained to work as a team, not independently. Dentists are trained to be operational in all aspects of dentistry, going back to, well, if you're trained and you're expected to be in all operational areas of dentistry, well, you'll need to learn about TMD, dental doctor. But physicians, on the other hand, they are trained from the get-go to be team members, and they start out having a general knowledge of the body and a general knowledge of a hospital environment, and a general knowledge of all the sciences. And then they start to specialize. They go through a general internship or a surgical internship. They start to decide what kind of specialty or generalist they want to be. They can specialize in being a generalist. But generalists do not operate alone. And generalists know they don't do everything. And then they know they're not responsible to do everything. They're a generalist, and they are great triage agents. And there are certain things that they are able to do as a generalist and treat really well, and they differentiate very quickly what they can't do and what they shouldn't be doing, and they refer it to the vast majority of specialists. And in medicine, it's just the opposite. The vast majority of doctors actually are specialists, and a much smaller number are generalists. Again, I can't give you the exact number, but I can tell you, basically, it's a totally different situation between dentistry and medicine. Majority of dentists are generalists that are expected to do everything. And in medicine, the majority of physicians are specialists. They're not expected to do everything. They do what they know best in a very specialized kind of way. And the minority of physicians are generalists. And I'm talking about MDs now. And it's even getting worse because the general treatment, the generalist treatment of patients is now being dumped in the lap of physicians' assistants and nurse practitioners. They are the new level of generalists. And more physicians are becoming specialists. Now, what is this physician's responsibility? Well, the physician's responsibility is, again, being aware and having the knowledge of the problem itself, how it works, and what to do about it. Being aware and being convinced that it's not a complicated problem, because the physicians they know that they are not going to treat TMD. It's connected to the jaw, which is connected to the teeth, which totally delimits the physician's interest or desire to have anything to do with TMD. That's why if they think the patient has a TMD, TMJ problem, they will say, go see your dentist. Or at the very best that they can do, go see a TMJ specialist. So the physician's biggest problem is they confuse it with other diseases. They misdiagnose it, mistreat it, misdirect it, because they are confused, and they are aware of this catch-all called trigeminal neuralgia, which is the catch-all diagnosis for any unexplained various pains in and around the face, jaw, oral cavity. And without any specification, because of limited knowledge and understanding, the physicians all call it trigeminal neuralgia. And then many of them treat it with drugs. or they don't treat it at all. They go see your general dentist. But the awareness problem is, again, understanding and teaching the physician colleagues about this problem. And so they are responsible to some extent to answer that question to the patient who says, how come nobody ever told me about that? I've had my doctor, PCP, has been aware of these symptoms for 20 years. Or they will say, I have seen 5 doctors, 10 doctors in the past few years that I've gone to for one or more of these symptoms, and nobody ever told me that there was an easy solution. And that is actually commonplace here in this practice. I mean, the majority of patients we see have a similar story to that they've seen multiple practitioners, dentists and physicians and specialists in each area, and for years, trying to figure out or to complain about these symptoms, and that these are misdiagnosed, mistreated, or misdirected, sending it, if you have unexplained pain around the face, then it's sent to the neurologist, who I can promise you treats it with drugs. Why would you want to treat inflammation of the temporomandibular joint with neuroleptics or psychotics or any other kind of drug, which doesn't help, doesn't fix the problem? Why would you want to do that? Well, it's because the doctors don't understand. They don't have the knowledge. When I say doctors, in this case, I mean physicians. So part 6 here, who's responsible to answer that question? How come nobody ever told me about it? Well, it's the doctors, that patient, doctor or doctors, which can include dentists and physicians, also physician assistants and nurse practitioners, also can include chiropractors and physical therapists. How come nobody ever told me about this? Because the doctors who should know about the problem, at least enough to know how to recognize it as it is and not confuse it with something else in the differential diagnosis, they are responsible. That is what has happened. That is what continues to happen. And again, here in Middle Tennessee, our practice is fortunate enough to have a greater and increasing number of doctors who are becoming aware because of our aggressive, some may say too aggressive, that's okay. We continue to send out materials to all of our dental and medical colleagues about the problem, especially when we solve the problem for one of their patients, which letters go out. Your patient, Molly Jones, with headache, earache, jaw pain, now says 95 or 85 or 70% or 100% of those symptoms are not diminished or decreased. That is why we now have over 850 referral sources and continue to have referral sources coming in from doctors, nurse practitioners, physicians, assistants, dentists, oral surgeons, and neurologists from all over Middle Tennessee. That's good for us, but I'd like it to be good for you, because if you can duplicate what we've done here, then you've solved a huge problem in your area, and you won't run out of patients. 45% of females have TMD problems, TMD symptoms. Many of them, most of them, actually are ruining their lives, and they put up with it early in their life, in their career, and they end up in their latter career. I had one yesterday. Today is Tuesday. I see patients on Monday. I had a lady who had 40 years of symptoms, and she finally came in and says, I give up. I can't stand it anymore. And she admitted to me, I didn't have to ask her, and I do see that some people have a high pain threshold. And she admitted to me, she says, I'm aware that I have a very high pain threshold. And I won't go into how that happens. I'm not sure anybody really understands how that happens, but we do see patients with very high pain thresholds. I see it in athletes all the time, and definitely a category I see with athletes. I see it with farmers all the time. We see a lot of farming people here that's still in Middle Tennessee, and they are raised on a farm. They have a very high pain threshold. They don't consider pain like majority of people do. But this lady said, I have a very high pain threshold, and I can't stand it anymore. Who is responsible? How come nobody ever told her about that? How come they ever led her early in her career? It's our responsibility. It's your responsibility. And that's the category I want to talk today about. And I talked about. All right. I finished it up. I'll try to make it limited short. If you would like to learn more easily, we have an online course. If you want to be a provider to do the same service that we do here using the same device and protocol, you can go to www.urbanictmj.com, which is our website. If you'd like to talk to me personally, I invite you to talk to me personally. All you have to do is contact us. I can be reached at tony@tmjservices.net. Our Director of Marketing Education, Dr. Naomi Williams, can be reached at naomi@tmjservices.net. We have a lot of material. To become a network provider, all you have to do is take an online 2.5-hour course and be licensed, and you're on your way. And you can provide the same service that we provide here, and we will actually teach you how to market it to your fellow doctors, dentists, chiropractors, nurse practitioners, walk-in clinics, neurologists, PCPs. I challenge you to do that. I encourage you to do that. This is how we're going to solve this problem. This is the only way we're going to solve this problem. There is a solution. I'm Tony Urbanic. I look forward to our next episode. I look forward to the next topic. This is TMD Demystified.